Hello everyone, I am Dr. Abhinaya. I am a pediatrician. I am dealing with Nelson-based teaching of pediatrics. So we are discussing the chapter on hematology. So in that we will be discussing today on pancytopenia. So there are various congenital and acquired causes of pancytopenia. So predominantly this discussion will be on congenital pancytopenia. I will be discussing on very interesting syndromes. So let's get started. First is Fanconi's anemia. So Fanconi's anemia is a multi-system involvement and it is a hereditary disorder. So what happens in Fanconi's anemia? There is anemia also. It is a bone marrow failure syndrome. It has a predisposition to malignancies, especially myelodysplastic syndromes, AML and many epithelial cancers. Fanconi's anemia has the greatest incidence in Ashkenazi Jews. It is inherited as an autosomal recessive disorder. What is the problem in Fanconi's anemia? There is a gene called as FA gene. Any mutation in the FA gene will lead to defective DNA cross-linking and repair. So, DNA repair does not take place. Increased chromosomal fragility happens in Fanconi's anemia. So, this is a small picture, self-explanatory. Autosomal recessive genetic disorder due to chromosomal breakage and common in Ashkenazi Jews. So, what are the features? So, short stature. Fanconi's anemia typically have short stature, strabismus, low set ears, deafness, abnormal thumb or absent thumb. Many bone marrow failure syndromes have abnormalities in thumb, but Fanconi's anemia thumb can be entirely absent also. Hypopigmentation of the freckles and aplastic anemia is very common. So, the pathology is extreme chromosomal fragility, bone marrow failure and physical anomalies. This is a triad in Fanconi's anemia. What are the clinical features? Bone marrow failure happens in the first decade of life. So, what are the common physical anomalies? I have already seen short stature. Apart from that, CDH, abnormalities involving the thumbs and the radii. Skin can have kephale spots, hyperpigmentation or vitiligo, short stature, endocrine abnormalities, hypothyroidism, hypopituitarism, genital abnormalities like hypospadias, phimosis and abnormalities in the kidney like ectopic or horseshoe kidney. These are the clinical features in Fanconi's anemia. So, this is a child with Fanconi's anemia. Note the multiple birth defects. The child is of short stature, microcephaly, microphthalmia, hyperpigmentation of the skin, epicanthal folds, CDH. So, this slide will give you the physical features which are seen in Fanconi's anemia.